Moving on to the diagnosis of atrial fibrillation, classically we're going to get an EKG in these patients, which is going to show the absence of distinct P waves. Very high yield to keep this in mind. Additionally, these patients are going to classically have an irregular rhythm, and this is seen most easily in the irregular pattern of the QRS complexes. So if we take a look at our EKG here, and you will notice this as we move along in our extended version of lead 2, you will note that prior to these QRS complexes, we do not have distinct P waves. So you'll note this here, how this baseline remains flat. There's a lack of a P wave here, lack of a P wave here, lack of a P wave here. And ultimately, we should look for the absence of these P waves in other leads as well. We can see up here in V1, for example, that again we have this persistent lack of P waves. Again in V4, I don't see any P waves here. And so this absence of distinct P waves is highly characteristic of atrial fibrillation. Additionally, these patients are going to have an irregular rhythm. And we don't necessarily need to whip out the calipers in order to note this. But as you will see, for example, here and here, we have this distance between the QRS complexes, whereas from this QRS complex to this QRS complex, it's a completely different distance, and you will see that this irregular pattern is present throughout this entire strip, and this is highly characteristic of an EKG in a patient with atrial fibrillation. So clearly in these patients with suspected atrial fibrillation or suspicion for atrial fibrillation, we should obtain an EKG in order to note this characteristic lack of P waves, as well as an irregular rhythm. Additionally, because thyroid disease can ultimately tip patients into AFib, we are going to get a TSH as well as a T4. Additionally, very important that we stratify these patients in terms of their risk for stroke, because as we stated previously, these patients are at an increased risk for the development of CVAs, given the potential for this rhythm to result in clot formation in that left atrial appendage, and ultimately that can be sent off to the brain, resulting in a CVA. And therefore, we're going to do this using the CHADS-2 VAS score, which we will now go through in detail. And the reason that we ultimately stratify patients in terms of their risk for stroke is because this is going to help determine their therapy, especially when it comes whether or not to give these patients anticoagulation. So here we have a table indicating the various criteria that make up the CHADS-2 VAS score. And very important right off the bat to point out here that we have two criteria which are going to give the patients 2 points rather than 1 point. These include having an age that is 75 or greater, as well as having a stroke, TIA, or a thromboembolism in the past. Either of these will give the patients 2 points. Going through each risk individually, if the patient has congestive heart failure, they will get 1 point. If the patient has hypertension, they get 1 point in terms of their CHADS-2 VAS score. If the patient has age that is greater than or equal to 75, then these patients will get 2 points. If the patient has diabetes, they will get 1 point. If the patient has a history of stroke, TIA, or thromboembolism, including DVT and PE, then these patients will get 2 points. If the patient has the presence of vascular disease, for example, a prior myocardial infarction or peripheral vascular disease, then these patients are going to get 1 point. Being between ages 65 and 74 gives the patient just 1 point, in contrast to patients who are 75 or greater, who get 2 points in terms of their CHADS-2 VAS score. And last but not least, the S in CHADS-2 VAS stands for sex category, in that if we have a female patient, then they get 1 additional point on their CHADS-2 VAS score. So ultimately, we sum up the patient's score based on the criteria that they possess, and this is going to spit out the patient's stratified risk score in terms of their CHADS-2 VAS score.